abortion and its practical facts. In India, after 18 years of age, the abortion procedure is a legalized one. So without any backstep, you can just go and approach to the doctor and get the treatment as early as possible when you don't want the pregnancy. First thing is to get the doctor's consultation in this sort of things. Don't opt for any on-counter pills. What might happen if you go for an on-counter pills? Before starting any abortion pills, there is something called based on the gestational age and their location. If sometimes it can be an ectopic pregnancy. So doctor would take the call to see whether it is inside the uterus, what is the age of fetus, and what dose can be given. If at all it's a scarred, unscarred uterus. All these things, parameters are there when a doctor decides the dose. It cannot be so easily done by a on-counter medications by your own. Why this is very important? If you take some haphazard or random medications by your own, it might end up in having retained products of consumption, where it is still more severe. Something which might be going with pills with the doctor's advice, it might end up in having a surgical procedure called as a DNC or suction and evacuation. So minimal procedure is with minimal side effects. So maximizing this sort of complications, like say if at all it doesn't go properly out, it might be ending up with retained products of consumption, infections which might further affect your endometrium and the future pregnancies. So the most common doubt, abortions, will it have any side effects? Any procedure will have its own effects. It's not like it is 100% without any effects, but when all these things occurs under a doctor's guidance, the side effects can be minimized. So the first and foremost thing is like get the doctor's prescription, get the doctor's guidance in this, be under proper checkups, follow-ups, get it clear that everything goes on well, and then only stop your follow-ups. Ultimate message is when you're not planning for the pregnancy and you're sexually active, try to opt for the contraceptive methods. Like say it can be in the mode of any of the properties or pills. You get a good option from your doctor which suits you. First and foremost things, avoid the pregnancies occurring which you don't want. First thing. Second thing, if at all the pregnancies are occurring, go and meet the doctor at the earliest such that the intervention will be minimal, and get the things done, everything under the doctor's guidance. Don't take any self decisions. Keep your health in the first priority.